Good evening. My name is Henrietta Conquo, and I will be demonstrating the newborn assessment today. First of all, when I go into the room, I wash my hands, provide hygiene, and I will introduce myself to the mom and also to the dad if he's around. And after that, I will identify the baby. I will do that by making sure that the bracelet is on, it's usually on the ankles, and I will uh, uh, I will verify that. I'll match that with the mom's. Usually, mom has hers, and she'll read out the number to me, and I will compare the number to make sure it matches with the baby's. And after that, I will locate to make sure that the security sensors is on, which usually at the opposite ankle. And uh, after that is done, I will now start my assessment. I'm gonna start with the vital signs. And maybe right now, baby is sleeping. And before I start, my baby he's a boy, and he's about 16 hours old. And I'm gonna start with the vital sign right now. Um, so right now he's sleeping. Um, just like right now, I can read out the respiration. I'm gonna watch him to monitor the respiration. I will count the respiration to look to see if he's using any accessory muscles to breathe, any nasal flaring. Look at his face for color, which is color is normal, it's pink. And um, the rhythm of the respiration, is regular, and the depth is okay. And normal range for babies' respiration is between 30 and 60. From counting with the respiration right now, I get like about 48. So after that is done, um, I'm gonna quietly, don't want to wake the baby. I'm gonna listen to his heart rate. Um, I'm gonna open up a little bit, listen for the heart rate for 1 full minute. And also, when I was counting the respiration, it have to be for 1 full minute. So the respiration is like about um 148. And normally normal range for babies heart rate is between 120 to 160. And also right now, while I'm staying here, I'm gonna see if I can check his temperature. His temp is like about 90, his temp is 98.3, which is within normal limit. Normal range is between 97.7 to 99.5. So while I'm doing all this assessment, I will make sure that I maintain the baby's body temperature. So after that is done, I'm gonna start with the baby's head. I'm gonna take off his hat, and I'm gonna feel to make sure for symmetrical, the baby's head is symmetrical. I'm gonna feel for any swelling or molding or keep tooth that's not noted. And I'm gonna feel for the frontal. The interior part is flat and is soft. And also gonna move down and check the posterior part is flat and is soft. And also the sutures is present on. And after that, I'll put the hat back on. So after that is done, I'm gonna, why not stay here? I'm gonna look at, inspect baby's face. The face is symmetrical. Um, um, the general face is intact, is symmetrical, and the eyes is symmetrical. They're both in right position. Right now, doing this, baby is awake, and I can see that his eye is moving. Okay, and there's no drainage noted in his eyes. And okay, I'm gonna look, assess his nose, and I'll search for see for any nasal flailing. There's none, and I'm gonna check for patent. I'm gonna close one nasal, so see if he can breathe to the other one. I mean, from the other opposite one, which he did. He can be able to breathe, no problem. And I'll do the same to the other one. His noses is patent, and I'm gonna look at his ears. The both ears in the symmetrical, what semi-equal, symmetrical. There's no drainage, nothing in both of them, and they're all in right position. His eyes, the nose, mouth, everything in the right position. Okay, after that, I'm gonna assess his mouth. And so right now I'm looking at his mouth. His mouth is pink and it's moist. I mean, the lips is pink and moist. So to assess the tongue, I'm gonna put a gloves on. I'm gonna assess the, look at his tongue, and also palpate the palate, the soft and the hard palate. I'm gonna put my finger, looking in this, his tongue is pink, and the soft palate and hard palate. There's no hole noted. So after I do that, and while I'm doing that, I'm putting my finger there, the baby might start sucking. So by then I assessing that like the sucking reflex is there. And also I'm gonna assess while I'm still here, I'm gonna assess for rooting too. So what I will do, I will put one of my finger to the one side of baby's face, and he will move towards that area and start sucking. So that's done. So next I'm gonna assess baby's neck. I'm gonna assess for webbing. So I'm gonna move baby over and look at his neck, which is right here, and there's no webbing noted. Okay? And while I'm doing that now, I'm gonna check for movement to see if baby can be able to move his head to side, back and forth. So I'm gonna move baby's head to one side, which is okay, and the other side, which is okay. So that's a range of motion too. That's baby's range of motion. So after I'm done with that, I'm gonna open, I'm gonna open baby's chest. So I'm gonna open the chest. I'm gonna only expose the area I'm working on. So I'm gonna start by look at the chest, the symmetrical, equal bilateral, and I'm gonna look at his arms. His arm, I'm gonna search for sizes. They're both equal symmetrically, and the movement, they can be able to move. They have good muscle tone. So I right this hand, I'm gonna assess for palmar creases, which is not here, it's not noted. I'm gonna count the baby's digits, the baby's finger, to make sure they're intact. All of them, they're intact. Okay. While I'm still here now, I'm gonna assess for brachial pulses, which is at the axillary. Okay. They're intact bilateral, equal bilateral. So I'm gonna assess the clavicle to assess to make sure that it's not broken or any creps, any crepitus. I'm gonna pipette. That's not noted. And also pipette for brachial pulses, which I said already. And that is done. And the next, like I said before, his chest is symmetrical, and from there I'm gonna check for respiration to see if he's breathing. I mean, his respiration, if he's breathing with the depth of respiration, which is regular, and also I'm gonna listen for breath sounds to all log fields, interior, posterior, and lateral. So they're all clear to all fields, and the next I'm gonna escalate for heart sound. I'm gonna check for apical pulse. So 1 4 minutes. It's apical pulse. There's no normal noted with the apical pulse. So next I'm gonna assess baby's I'm gonna inspect his baby's abdomen. um Look at his abdomen to see if he's moving with respiration, and see if there's any masses, any scars. No was noted. So, and while I'm doing that, also I'm doing the integumentary, like the skin all over. The skin is pink, and the skin is soft, and there's no birthmark noted so far, and no scratches. Um, Also, right now I'm gonna escalate for bowel sounds, like in adults. Okay, and the bowel sounds is active. So when I finish here, um, I'm gonna cover babies up. So what I forgot to say with the reflexes with the arm. So I was supposed to check for the uh, palmar. It's like when I touch the baby, when I use my finger to touch baby's hand, he will grab me, hold on to it. And also, I can assess the moral. So it's like when you sit baby up, and it's like you let go, he will, oh no, open up his arm. So that's done. I'm gonna cover that part up, and I move to the lower um extremities. So I'll start with the legs. Okay. Um, the baby's leg. I will say both legs. They're equal bilateral. None of them is. I mean, both of them are equal. And assess the movement. They can be move. Um, and also I will assess for femoral pulses, which is intact, bilateral, and I will search for the palmar creases too for the feet. That's not noted. And I also count the digits. It's intact. And I will also check for the muzzle tone. I'm able to move their muzzle. Muzzle tone is intact. And I will check for leg reflexes right now. I will check for the Blavatsky. So when I touch the babies, stroke the baby's feet, will flare his toes. And also I will check for the um, plantar. So it's like plantar is like when you touch them, the toes kind of, pulled out and the other one put together. So after that, I will search for the measure, like baby it already has our back. Then I'll pull the diaper out, and I can see that baby already had his first bowel movement, which is McConney. It's always like dark in color, and it's already void, and this diaper right now is wet. So um so by him having bowel movements shows that his anus is pregnant. And also I said he's gentler. He's I'm gonna assess his penis, which is intact, and assess the scrotum, and assess for the tools. For the two of them are intact there. And urinary meatus is on tip of the penis, as intact. What I forgot to say is, like, I was supposed, when I was doing the abdomen, I was supposed to like when I remove the diaper, I can access the umbilical cord. Where the cord has three vessels, two arteries and one vein. Okay, and now I can access the baby spine. Um, his spine is straight, and it's intact, and his legs are straight, intact. I'll access the glutes folds, and also right now his skin on his back, the color is pink, it's soft, no scratches, birthmark noted. Um, 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 I think, oh, that's all I have for the assessment. Thank you.